Hi, my name is Tatiana Savage, and I do not have my badge on me today. It is quarantined at school, but normally I would have my badge. I'm going to be explaining intramuscular medication administration. So first I will start off by explaining all of the sites that this medication can be administered in. So I'm going to start with the deltoid. You can find the deltoid by finding the acromion process and the axillary fold. So you're going to imagine an imaginary line laterally on the arm, and the base of an imaginary triangle will be at the acromion process. The tip will be at the lateral line. So in the center of this triangle, you will find the injection site. It's usually 3 fingers below the acromion process or 2 inches. You want to make sure that your patient is sitting up or standing down, their arm is relaxed, and to pull their sleeve up over their shoulder. If their sleeve cannot go or it is too tight on the shoulder, then you need to remove the garment. The second location is going to be the ventrogluteal site. So when you find this site, your patient will have to be laying on one side. So if they're laying on their left side and their right hip is facing upward, then you need to use your left hand to locate this site. So you're going to put the palm of your hand on the greater trochanter. You're going to use your index finger to point up at the anterior superior iliac spine. Your thumb is going to be pointed towards the groin, and these 3 fingers will be moved outwards to form this finger arrangement that will look like a V, and in the center of this V you will give your injection. So if this can simulate my opposite hand, my palm will be in the center of my greater trochanter, and my thumb will be pointed towards my groin. My index finger will be pointed up at my anterior superior iliac spine, and these 3 fingers will be moved outwards to form a V. Okay, the next one is going to be the dorsogluteal site. To find the dorsogluteal injection site, you're going to need to find the greater trochanter and the posterior iliac spine. You're going to draw an imaginary line from these 2 points. So you're going to think of this as as quarters, and you're going to do the upper outer quarter of this. So by upper outer quarter, I mean pointing towards this way. So it's going to be about right here. You don't want to move too medially, because if you do that, you run the risk of injecting into the sciatic nerves, which could cause great damage to your patient. So the next one is going to be the vastus lateralis and the rectus femoral injection sites. You're going to find these by placing one of your hands at the top of your thigh and the other one just above the knee. You're going to move your thumbs to form a 90-degree angle with your fingers and thumbs, and between your thumbs is where you will find the injection site. So the injection site will be right about here on the thigh, and that is for the vastus lateralis site. The rectus femoris site is just going to be superior to that site, and you can find it in the same fashion using your hands and thumbs. So in reference to it being superior to that site is if your patient is laying in the supine position on their back, and the rectus femoris will run here down the front of the thigh, and the vastus lateralis is going to be just underneath it, which will be exposed here on the side of the thigh. So now that you know all of the sites, it's time to perform the lab demonstration for intramuscular medication administration. I will start by checking my doctor's orders with the MAR. And this is just a doctor's order printed on a sheet of paper, blank on the back, a blank sheet of notebook paper that I'll be doing my calculations on. So here I see that we have a patient recovering from a hip replacement surgery and rates their pain as a 10 on the pain scale. there is an order for morphine 7.5 milligrams, IM, PRN, post-surgical pain. So I know that we're going to be working with morphine, and Davis's Drug Guide for Nurses has alerted me that morphine is a high alert drug. And the information that you can find in here will explain to you that you need to double check all of your calculations with your nurse before administration and make sure that you're injecting the right medication, double checked as well. You're going to want to address all of their vital signs and their level of consciousness as well throughout the administration. Now that we know all of that and you've checked your doctor's orders with your MAR, you are going to assess your patient for any allergies and perform hand hygiene. So my patient says that they do not have any allergies. That's great. Now I'm going to explain to you, you need to check your medication when it was the time that it was last given, and the location that it was last given at. And then you need to know, is this a safe time to give this medication? And yes, it is. So now that we know that, we can gather our supplies. My supplies today will be an MAR, which is going to resemble that piece of supplies, my medication, a 3 milliliter syringe, a needle that is a 23 gauge, 1 to 1.5 inch, an alcohol pad, and that is it. When you gather your supplies, you need to know that before you remove your medication from the storage area, you need to double check it with the MAR. You also need to double check it with the MAR after your preparation and before administration. Now that you've done that, you can perform your calculation of this medication. So I have a order for 7.5 milligrams of morphine. So I'm just going to write 7.5, put that over 1, put an X, and then you have 5 milligrams. Let me write milligrams here, 1 milliliter, and we're trying to find milliliters. So this is going to look like 7.5 over 5. Oops. Okay, so 7.5 divided by 5 equals 1.5 milliliters. And here is my calculation. Okay, so now that I have done that, I know how much medication I will be preparing in my syringe. So you want to make sure that you keep your syringe sterile and your needle sterile. So that includes the plunger part on your syringe as well. You're going to use an aseptic technique for this. And now knowing that you have double checked your medication with your MAR, and you are going to check your medication expiration date, which this is in date, and you're going to check for any contaminants or defects to the bottle, which there are none. You're going to remove the metal or plastic lid to this medication, get your alcohol pad, and you're going to rub the cleanse the rubber part of this medication bottle for 30 seconds. You're going to allow that to air dry, and this is where you will prepare your needle. We are going to be doing 7.5 milligrams of morphine, which I've done the math here. So that's going to be 1.5 milliliters. So with my 3 milliliter syringe, I'm going to withdraw 1.5 milliliters of air. So I have aspirated 1.5 milliliters of air. Here, can you see it well? Like perfectly? Okay. All right. So now that I've done that, I can inject this air into my medicine container. So my air is injected into my medicine container. Now I will turn my medicine container upside down. Make sure that my needle is below the fluid level. and that I am not touching my needle or my plunger, and I will withdraw 1.5 milliliters of liquid. So I have withdrawn 1.5 milliliters. And here, let me put this behind it. Can you see it okay? Okay. You will thump the syringe to kind of try to remove any air bubbles that may have gotten into the syringe. You want to make sure that you get all of them out. Oops. And you want to make sure that you do not expel the medication. If you see a drop at the tip, that's good. That lets you know that your medication is ready to be administered and that there isn't air in there. So I would activate a safety on this, but I'm just going to do a little scoop technique for the video. You would remove this needle, place it in your sharps container, and you would open up this new needle and put this on here very carefully. Now that you have prepared your medication, you want to double check it with your MAR. Okay, it's the right one. I got my calculations right, checked with another nurse, and now you're going to gather your supplies to go to your patient's room. So you'll need your medication. This is going to resemble an MAR, and you will need an alcohol pad. So I got all of that together, and I'm ready to go to my patient's room and begin my procedure. I'm going to ask my patient what their name is. I'm going to check their wristband. I'm going to ask them their date of birth. I'm going to ask them if they have any allergies again. And after I have done that, I'm going to perform my hand hygiene, and I'm going to don clean gloves. Okay, now that I've donned clean gloves and assessed my patient, I'm going to position my patient for the procedure. I'm going to expose the injection site, and I'm going to provide privacy for my patient. So now that I've done that, I need to find my site that I will be injecting in. I need to cleanse the site. So you're gonna go from the center outward in a circular motion for 30 seconds and allow that to dry. And then once you have done that, before you administer your medication, you need to double check it with your MAR. Everything has checked out. So you're going to hold your hand whatever specific way you are supposed to, whatever area that you're going to be injecting, and I explained those earlier on in the video. So I will just be holding my hand like this tightly. I'm going to remove my cap. I'm going to inject my patient at a 90-degree angle, holding my syringe like a pencil. I'm going to hold the needle with my non-dominant hand. I'm going to aspirate to check for blood. There's no blood. And now I can begin administering the medication. Hold for just a second, remove, and you're going to take your alcohol pad and hold it on your patient. You are going to activate your safety on your needle. Make sure that you're massaging your patient's injection site, and you can bandage your patient if they're bleeding. You can dispose of your needle in your sharps container, and now you can reposition your patient for comfort, remove your gloves, perform hand hygiene. And now that you've performed your hand hygiene, you can document what the procedure that you did was. So you're going to go to your MAR and you're going to initial by the time that you gave this medication and the location that you gave the medication in. And you're also going to check up on your patient in 30 minutes. To assess the effectiveness of your patient. And I just wanted to make sure that I explained that you have to hold your needle at a 90-degree angle. And that is it for today. Thank you for watching.